designed implants. The tip should be small. But as far as placing a single piece implant is much easier because the drilling involved is only 1 or 2 drill. Already that area, the area is very small. So if you do a lot of drilling with conventional implants, that may mash up. So placing single piece or compressive or basal is very much easier in pterygoid than conventional. Especially if you are planning for conventional, then you have to open the flap till the pterygoid area. Okay. So for this patient, we are not going to place pterygoid here. We are going to place 6. Okay. Whether single piece implant or multi-unit single piece, we will decide later. So one implant in the palatal socket along the palatal bone. Okay, either in the palatal root area or in the mesio-buccal root area, whatever it is. Now we will see the first premolar area. If you see here, if you go towards the sinus, the bone available is less. Okay. But if we tilt, even if it tilt without tilting mesially, if you tilt palatally, it goes into good bone. So we'll try tilting slight mesially also. Okay, 4.2 into 20. We can place a long implant. Of course, we may do some alveoloplasty. Then we are planning one more implant in the first premolar. First premolar slightly mesially tilted. There is more length available, and we place the key areas. One of the key areas, the 1-1 area, right? If you see here, for this patient, the incisive canal is very much small, not very big. So our final plan is one implant in the molar area, palatal root. Second premolar, first premolar slightly mesially tilted, and one implant in the 1-1. Okay. If I am going for screw retained option, I will place only 3 implants is enough. No need to place 4. Okay.
Screw retained, you mean the bar?
Bar. Okay. So the right side planning is over. Now we are going for the left side. You will see the
first premolar, second premolar, molar. Okay, sir, not very close.
You are telling these are close. Yes. So that is why from here we are slightly tilting mesially. From here we are tilting slightly mesially. And we are not going to place any implant in the central. Sorry, canine or lateral. Straight away we are going for
Only 1
implant. 1 4 1 5. Yes. 1 4 1 3. So if we are planning for screw retained, what we can do is we will place this implant, and this implant. That is enough. So we'll see the 6 area. This is the 6 sealed area. Okay, not very great bone. If at all we place implant, it may be only 8 mm. Only 6 mm is there. We can place the 8 mm implant pushing the sinus floor. Okay, just we are analyzing the options. So we are seeing the 7 area now. No bone, right? This is the distal of 7. Maybe palatal socket. We can place not very great implant. Eight also not good. Okay. If you see here, the pterygoid, the sinus has gone till here. So if you go through here, it will be perforating the sinus. It's called transsinus. Whenever we are going transsinus, the situation becomes complicated, difficult, because we are losing the guidance. Once you are inside the sinus, there is nothing. So left side pterygoid is So whenever you are planning for pterygoid, first check whether it is a good case for beginning to attempt pterygoid. Okay. Whenever the sinus has pneumatized the tuberosity, then it becomes a difficult case. This will try the planning. So we are starting from the 8. If you see here, it is going through the sinus, then only it is catching the fusion zone. You can also see here, the sinus is here, then only it is catching the zone. Lower. Okay. So in this kind of situation, what I do is I try to avoid pterygoid as much as possible. So I try to find some place here. If I cannot place pterygoid, what I plan is I go for a bar, then I can give a cantilever. Alright?
So anyhow, when we are placing bar, so the number of implants can be reduced because we have.
Yes.
So if the patient economically they're not affordable, like we say all on 4 or all for that. In the basal, if we want to, ideally you said 8, 4 on each quarter.
Yes.
To compromise on the patient's economic status with the bar, what can we reduce it to like 3 soning?
Reduce the number of implants in school time.
That is also costly, no?
It's costly.
And the bar, it comes same cost, bar code, like implant, we usually tell the patients with the implant charges, and plus or minus we don't charge based on complete overall. In the component, patient economically they don't want, but they are willing to go with immediate loading. On the bar code, stability, you said cantilever
Yes, cantilever.
like conventional all on 4 mari, like place in between in the midline and one in the posterior and the bar. And 4 போட முடியுமா இந்த இதர கேக்குறேன்.
Screw retained multiunit. We have tried only with 6 implants so far. We have not done all on 4.
Okay.
Maybe one patient today we are planning to try with all on 4. Okay, if it works out, maybe after 6 months I can give the answer. If it works out, then all on 4 also we can do it.
Okay.
Okay. So all on 4 you will get 1 molar cantilever. We will start the implant from second premolar, tilt it, and 1 molar will come cantilever. Okay. So what X-ray we saw now, it is all on 6, 2 pterygoids, anteriorly it is all on 4, but we are supplementing with pterygoids. So this patient.
And one who's like pterygoid putana, it should be always bilaterally. We should take the support, or one pterygoid and the rest.
No, only one pterygoid you can take support and you can leave the other pterygoid, no issues. This is the second premolar. Okay. The second premolar, see the sinus has come down till the apex. Palatally also there is not that much great bone. But now what we can do is we can tilt mesially and we can check. Before that we will see the first premolar. First premolar we have got good bone, but from second premolar we are tilting the. So if you go straight, you are entering the sinus. So we are tilting slightly mesially. Okay, if you tilt this much from second premolar, it is a classic all on 4. From second premolar, if you go straight, you are getting less bone or you are entering the sinus. So that is why in all on 4 it is tilted slightly mesially and 1 tooth cantilever is given. The same thing we can follow here.
All on 4 normally
It is usually it is from 5 it starts and it reaches the buttress. From here it buttress and 1 to 1 implant. Okay. So left side, 1 implant slightly mesially tilted, 2 implant. Even we can do this as a cement retained also and give 1 tooth cantilever. Okay. Even in if you are giving cement retained, you can give 1 tooth cantilever, provided this last implant is good bone. If you place this implant as a short implant, then don't give it this cantilever. So there are 2 options in front of us. Yeah, one is 1, 2, 3, 4, 5, 6, 7 implants I can place, and you can go for cement retained. Or I will knock out this implant and knock out this implant, and we can go for all on 5. Okay. So this is nothing but classic all on 4. Just we are supplementing one extra one. That's it. That also we can try. Actually, we wanted to start all on 4 with this. We wanted to know whether it will work out. For good bone, please. If this is a good bone, lot of length is available. Definitely it will work. Whenever we are planning for bar, the only thing you have to make sure is you have got good prosthetic space. Because you need space for bar, then you need a minimum 3 to 5 mm is the dimension of the bar. So upon that we have to give the processes. So what we'll do is we'll do screw retained with this patient. Is an old patient.